Our first and only speaker tonight is currently employed as an extension educator and assistant professor, human and family development with Washington State University, Chelan Douglas County Extension. Her speech tonight is part of her application for tenure and promotion with Washington State University and features her contributions as extension faculty in 3 parenting education programming areas. Her 20-minute speech is scheduled to be delivered to her unit and families later this month in Spokane. It is patterned after the CC manual, Project 9, Persuade with Power, but as Lloyd said, it's not actually going to be a manual speech, but it could be. Please help me welcome Jenn Crawford with her speech entitled Extension Programming for Healthy Families and Healthy Human Development.
Now just turn power on the projector here, hopefully. You can hear it turning on. I started working with WSU Extension in 2008, shortly after my first daughter was born. Prior to that, I've worked locally in Wenatchee in mental health in a crisis respite center, and prior to that, worked for 10 years in Washington, D.C. in coordinating environmental business exchanges and advocacy for sustainable development, prior to which I had my master's degree from an international school in Northern California, and my degree is in international public administration there. My undergrad degree was anthropology. In the past 8 years with WSU Extension, my area of work is centered around Chelan Douglas counties with some statewide work and national work as well. And the red dots represent some of the major communities in Chelan Douglas County where programming has taken place, right in the center of this state. My 3 program areas that I'll talk with you about are Strengthening Families Program, Children Cope with Divorce, and Resilient Families Inside and Out. These are some of my partners working with various groups, schools, the court system, the jail, the Regional Justice Center, the local Center for Alcohol and Drug Treatment, early learning communities and educators, and of course youth families and the general community at large. A little bit of background on demographics in Chelan and Douglas County. The average demographics, there's about 65, 66, 67% are white, and the next predominant race is Hispanic populations, just under 30%, but note the gradated change where the older age group has a higher concentration of Caucasian, and almost half of children, young children up to age 4, are Hispanic. I'm a systems thinker. I've drawn from many different sources. First, one inspiration was in graduate school when I first learned about Peter Senge's work, recognizing connection between things, that nothing is really in a vacuum. 2 major lenses through which my programming can be viewed is what's known as the socio-ecological model, Bronfenbrenner. Most of you in the unit should well know what it is, but it recognizes that nothing operates in a vacuum. And I'm fortunate enough now to work in the individual and interpersonal level through parenting education. Another lens that I brought in my thinking and programming is from yoga philosophy, which is a system of looking at the whole person in a holistic way, in an integrated way, and interconnection between physical, mental, emotional well-being, and so forth. What happens inside a person. All all of my programming focuses on parenting education, and it's one of the most rewarding areas of work. And it's for any family. Parenting and what happens in families is not always easy. Even the highest functioning family the parent may dysregulate, as seen in this picture, where well-informed and well-guided parents would have a better disposition and more success for both oneself and their family members in this next one. All of us basically want the same things to grow, to flourish, yet we know that we all have different circumstances in life. Here's some realities that exist about what life is like now. Adverse childhood experiences, now commonly known from studies in Kaiser Permanente 20 years ago of 17,000 folks, showed us that adverse childhood experiences are common. In fact, most of the population has had at least one of the top 10 adverse childhood experiences mentioned below. In the state of Washington, 12% of elementary school students and 42% of high school youth have experienced more than 3. And a lot of studies have shown connections between the greater number of adverse childhood experiences, the greater likelihood of challenges later on in life. And one of the original authors of this study, Vincent Folletti, said the greatest public health advance that anyone could do right now is to figure out how to support parents who have no idea of what positive parenting looks like. This map shows parts of Chelan and Douglas counties where there's a higher level versus a lower level of adverse childhood experiences. So we'll see that the majority of both counties, only 11 to 21% have had them, but in some areas, nearly half. In 2008, I combined, some of this information has only come out recently, but I did a systematic needs analysis with about 100 people in 2008 and asked the same set of questions of organizations, schools, principals, community groups, parents. What are your needs? What's working well, what's not working? What are some big issues? What could Extension do to help? And some of the themes that came up based on this, here's a Wordle representation. The words that came up a lot were words that more people said more frequently. It's a nice tool. I encourage you guys to try if you haven't. If you're with Extension, you probably have used this at one point or another, though. But drug use, not knowing one's full potential, and a need for improved communications both within families and across agencies and collaboration seem to be a recurring theme. And that's been represented as a charge in all of the 3 program areas I worked. The first program I'm going to talk about is Strengthening Families Program, which has been delivered across both counties to family groups up to 12 at a time in school systems, 1 through 7 sessions, and it involves the whole family. It's one of the most widely known research-based, evidence-based programs known to be effective in building protective factors at the family level and the individual level to reduce long-term issues like drug and alcohol abuse. It includes a variety of well-crafted methodologies to engage families, for it to be fun, and separate sessions for youth and families that requires facilitators to be trained in the model, requires funding to pay for the program to be implemented. And since 2008, I've been responsible for implementing 24 programs to more than 350 families, or just under 350 families, where they each week come and build on these skills known to protect families. And they completed evaluations, both pre and post test, in which they learn, the parents assess at the beginning and end their how well they provide guidelines about and expectations about substance abuse, and they report on how fun they have with family members, how much fun they have together. They report on their ability to manage temper through family harmony, and their knowledge and use of communication skills. So these lines indicate where to look for each of these areas. And here shows the results in both Chelan and Douglas counties compared to Washington State, that there's been statistically significant positive change, which means that as a result of the program, every one of those areas is better as a result. And not only do the youth, the parents take this assessment, but youth do as well. They are ranking their parents, and they're assessing their own family dynamics in a similar way. And they're reporting how close they feel to their parents. They're reporting whether or not their parents use appropriate discipline strategies and rewards, how much fun they have together as a family. And if their parents, they report on their parents' ability to manage their tempers and their use of rules. And again, across the board, consistent, statistically significant positive change in all of these program areas. I also looked at county-wide data from the Healthy Youth Survey, from which some of these questions are similar to, the same questions, and saw that from 2008 to 2014, alcohol use rates among 8th graders, 10th graders, and 12th graders have gone down. It's part of the story, but one worth saying. And based on original randomized controlled studies of this program, it has been proven to show that about $3,000 per youth is an investment in the future by preventing future costs related to arrest, drug and alcohol issues, mental health issues, and so forth. But we wanted to verify that with the people who came through our program. And we conducted follow-up focus groups up to 2 years with families and with parents and youth alumni, and asked them systematically what they remember, how it worked, whether they would change anything about the program. We received a grant for 5 years to focus on possible adaptations to this curriculum for the Hispanic population. We found they liked it. They wouldn't change it. They felt connected to facilitators. In a poster last year at the National Council on Family Relations, some of these findings, and also Time 3 studies in which parents reported continued effects from participating in the program. Similarly, for the youth, we in 2 other locations in the state really looked at the data and qualitative data, found out what they were saying, and 4 themes emerged from youth. As a result of the program, they noted change, they noted improved competencies in their developmental stages, resiliency, and a 4th one. Symbolism. They remembered symbolism from some of the activities that we did, some of the family shields and so forth. The second program, Family Education, Parenting Education Program, focuses on the transition of divorce. Its goals are to minimize negative outcomes that are known to happen to youth over time as a result of divorce through increased conflict. It's not always so much divorce that's an issue, but how well parents handle it and model it. And since 2008, nearly 2,500 people have been through this 4-hour class. Most of them are there for divorce. And since then, I assessed what was already a good class working right and did see some weaknesses in the evaluation and redesigned the evaluation to better measure learning outcomes based on the content and also to come up with some reliable data that would measure the long-term goals that we hope say that these programs are supposed to, which are reducing parental conflict. And these are the core content areas of the program. So they learn about stages of grief for all family members. They learn about how to actively listen. They learn about how to access other needed community resources and manage economic changes associated with divorce. Co-parenting and child development. We show consistent gains in knowledge in all of those content areas. And after 2013, based on data up until then, we also found parents reported that conflict reduced over time. I'm also part of a nationwide extension group that's looking at similarities between programs and may change a little bit of the content, but the truth is that the judges and our local community values their evaluations are strong, and they're not wanting much to change, really. They're saying that it's a much-needed program and it has minimized the number of contempt hearings in post-resolution dispute issues. I designed some fact sheets that could be used not just for those in the class, but for any educator or adult who works with children. They could be used as refrigerator fact sheets, as references of what will help or hinder supporting kids based on developmental stages. And I'm hoping that dispute resolution centers across the state and 4-H folks will use that material. The third program area is Resilient Families Inside Out. And that is another parenting education program that combines both core parenting education and life skill modules with guided experiential mindful movement and yoga. We originally started this program in the jail back in 2008. I received a grant, a 3-year grant from an agency which is now Department of Early Learning to build capacity in that area, and they helped us with evaluation. It was popular from the very beginning at the jail, and we redesigned the program and the evaluation itself to better measure some core outcomes that we want to happen among individuals to build their resilience. And so they were listed here for, and there were gains in all of these areas. Here's one gentleman who attended this program in the jail, and since 2003 has continued to be out in the jail and using these skills with his family. I've heard that a report from the education coordinator at the jail that he is now expecting another child, and as well as trying to gain custody of his older teenage children whose mother is using drugs and alcohol still, and he's close to securing that. Since 2013, the program has expanded at the Center for Alcohol and Drug Treatment. It was recently published in the North Carolina State University's Forum on Family Consumer Issues online journal about valuing maybe strategic partnerships, high-risk audiences, bringing parenting education not just to parents who are in the 28-day program, but to all adults. They see value in the entire program for helping them to manage stress and to re-look at their own childhood and upbringing and through different perspectives as they work on building some skills and looking at some of the core issues that may have partly been attributed to poor stress management as being in a drug and alcohol treatment center. This last April, I did an assessment, combined assessment, both of staff there who valued the program. They see it as complementing and reinforcing some skills that the counselors are wanting to work with individuals in. They see value in both the mindfulness training as well as the learning parenting skills. They require the program for all inpatients, not just parents. And the original 4 measures for resiliency, which have been validated the first 2 of which have been validated and are reliable, and yet one comes from yoga therapy whole person survey, and the parenting scale showed even stronger gains than the original jail group. We also did follow-up with participants at the center from 1 month to 2 years after, and I'll talk about that in a second, but this next slide shows the proofs, and I'm going to skip the statistical significance of the positive gains of the 4 skills. And they were asked, the parents were asked about how their relationship with children in their lives, whether they're applying discipline strategies, whether they're offering appropriate choices. And here's what we came up with. There was positive change in offering choices, but not quite statistically significant here. But we did find, and you'll see greater numbers of people who responded because everybody was asked the first 2 questions, whether or not that at all 3 times at the beginning of the program and then follow up. They're finding the program valuable. They're improving their ability to manage strong emotions. And they were showing positive change in the other skills as well. However, it wasn't statistically significant, strong enough, the bottom ones. Also, this summer, an article in the California Journal of Health Promotion featuring the program at the jail was just accepted for publication, was in the press. And this sums up the 3 program areas of work that take a systems approach of recognizing interconnection and the complexity of change. And I look forward to continuing to develop and expand these programs through new funding and sustainability, and continuing with extending parenting education to the general public, maybe through radio, info, commercials, and continuing to do applied research on an area near and dear to my heart of the connection between mind, body, and emotion.